we, like the rest of society, was really focused on making sure we were testing those that had symptoms and were showing up with symptoms. Over the last couple of months, we have done more testing of those who don't have symptoms, so folks that are deploying on a mission, some of our strategic assets, and so we would expect if we're doing more testing of those that are asymptomatic, we are going to see more. We would see more of an uptick in cases. So right now, our focus is looking at the data we have with regard to our particular, installations and health facilities in those areas where there are hot spots in the community, and making determinations based upon what's happening on the ground.
Still a no-go for travel, but Texas and Arizona.
The guidance from the department is that we provide data and factors for local installation commanders to use in making decisions about what types of public health mitigation strategies they want to put in place for their installation. It's very much tied to what's happening in their community. As I mentioned, we are seeing some upticks in the same places that there are upticks in the civilian sector. Again, that is not necessarily overly surprising in that we've been doing more testing, and we've been doing more testing of those that are asymptomatic.
You're in military active duty, right?
On the context in terms of asymptomatic and symptomatic, again, what we're seeing, which would not be surprising, that as you do more testing of large groups of people, and a big chunk of those are folks that are not presenting with symptoms, so they're asymptomatic. Those typically, not across the board, but tend to be the younger demographic. And so it's not surprising to us that we're seeing an uptick in infection rates, particularly where we're seeing it in a local community.